39,509 euros. That's how much a regular employee got back from her public health insurance because she paid too much for years, without even realizing it. That's almost 3,000 euros every single year gone just because she did one of the 6 biggest health insurance mistakes. And she's not alone. You could be in the same situation. Or are you 100% sure you're not paying too much or getting too little back? Stick around, because I'll show you the 6 biggest health insurance mistakes in both public and private insurance, and how you can avoid falling into the same expensive traps. Public health insurance in Germany keeps getting more expensive. Last year alone, contributions jumped by 11.87%. The good news? About 95% of benefits are the same across all Krankenkassen. But the Zusatzbeitrag, the additional contribution you pay, can vary massively. So if you're still with the same insurance out of habit, you could be wasting hundreds of euros every year. Right now, the lowest Zusatzbeitrag is BKK Firmus with 2.18%, and the highest is Knappschaft with 4.4%. So you can put more than 730 euros back in your pocket every single year just by switching. But many people never do. Almost half of all Germans have never switched their Krankenkasse. And yet switching is incredibly simple. Just apply at the new insurer and they'll cancel the old one for you. No medical check, no stress. Of course, it's not only about the price. Some public health insurances cover extras like dental cleanings, osteopathy, or even fertility treatments. So don't just pick the cheapest, pick the one that truly fits your health needs the best, without overpaying. While public health insurance mistakes can cost you hundreds, private health insurance mistakes can cost you thousands. Because one of the biggest errors is going for the cheapest private plan possible. Many young and healthy people think, why pay more for something I hardly use right now? And insurance ads also push this save today mentality. But in private health insurance, cheap plans almost always come back to haunt you. Like we say in Germany, if you buy cheap, you buy twice. And in private health insurance, that couldn't be more true. Cheap plans often cut corners on seniority savings, the money built into your premium to stabilize contributions later in life. Skip those and your premiums could explode in old age. Or they limit your benefits with strict caps. Imagine needing a prosthetic arm that costs 40,000 euros, but your plan only covers 15,000. The rest comes straight out of your pocket. That's why we jokingly call these cheap plans millionaire tariffs, because you need to be one to afford the gaps. Stiftung Warentest recently found that 69% of private plans fail to meet the minimum coverage standards. 69? Nice. Private health insurance should never be about getting the lowest price. It's about securing the best medical care for you and your family. And if you're earning more than 73,800 euro as an employee, or if you're self-employed, you actually have the choice between public and private. If you want help finding the right private plan, book a free meeting with us. The link is below. Because the most expensive plan isn't the solution either. It's about finding the plan that truly fits your needs the best. Back to public health insurance. Because even if you've picked the right Krankenkasse, you might still be wasting money if you're not using the extras and bonuses built in. Every public insurance offers bonus programs and additional benefits on top of the standard 95% of legally required services. But here's the problem. Most people don't even know they exist, and that's expensive. By doing simple things like regular checkups, vaccinations, fitness courses, or professional dental cleanings, you can earn cash rewards, vouchers, or even subsidies for your gym membership. Depending on your insurance, the bonuses range from 50 euro to nearly 500 euros a year. That's free money, just for taking care of yourself. So a win for your health and your wealth. On top of that, many Krankenkassen also offer Wahltarife, special optional tariffs that reward you financially if you use fewer medical services. Here's how it works. You commit to covering a small share of costs yourself with a deductible, meaning you don't submit bills for minor treatments. In return, your insurance pays you back a bonus. Stay healthy and you could get back up to 1 full monthly contribution. Pretty good! But private health insurance has a cashback that can be even more rewarding. Private health insurance takes it to the next level because if you're not using cashback, you could be missing out on thousands of euros every year. Many private health insurances offer what's called a Beitragsrückerstattung or cashback. If you stay healthy and don't submit any claims, your insurance rewards you by paying back part of your premium. The big difference from public? In public, cashback is capped by government rules. In private, it's not. So the longer you go without claims, the more cashback that you can get. Over time, some insurances pay back 4, 5, even 6 monthly contributions. Imagine that. You've been insured for a whole year, but only paid for half of it. And the other half is covered by your employer. So you're basically insured for free. So don't leave free money on the table. If you're on private health insurance, check whether your plan offers cashback and make sure you're using it. Be smart. Pay small bills yourself first and only submit them later at the end of the year if it's really worth it. While private clients can enjoy cashback, millions of people in public insurance are quietly overpaying, simply because they never check their Beitragsbescheid. Your Beitragsbescheid is the official notice that tells you how much you have to pay for public health insurance. And here's the shocking part. Studies show that over 40% of these notices are wrong, and the average mistake costs about 1,200 euro per year. The reasons vary. Sometimes it's wrong tax or income data, sometimes it's missing documents. Here's a real example. Someone had to pay more than 35% of their income to TK, almost twice as much as they should be paying. Why? Because if you don't submit full income records, your Krankenkasse can simply assume the highest possible income and charge you maximum contributions, whether you earned it much or not. Even family insurance can create nasty surprises. If a child didn't actually qualify for free coverage, your public insurance can and will demand back payments, often for several years. So never just throw your Beitragsbescheid away. Check it carefully, because ignoring it could easily cost you thousands. And speaking of checking carefully, private health insurance also requires ongoing attention. Which brings us to the last mistake. Most people think once they open their private plan, they're stuck with it forever. But that's simply not true. What many don't know is that you actually have a legal right to switch tariffs within your existing insurance. This is written into paragraph 204 of the German Insurance Contract Act. Of course, you can also switch to a different insurance. But if you switch tariffs inside your current insurance, you keep all your seniority savings. And in most cases, you don't even need a new health check, unless you're asking for more benefits. That means you can adjust your plan without starting from scratch, and the savings can be massive. Optimizing your private plan can cut your monthly contributions by more than 100 euros, often while keeping the same coverage. And in some cases, you even end up with better benefits at a lower cost. If you want to save too, use our free Perfinex contract check. The link is in the comments. And for even more tips, watch our video on how to lower your health insurance costs now. Thank you for watching und bis zum nächsten Mal.